The Fred Hollows Foundation acknowledges the traditional owners and custodians of the lands on which we work and recognise their continuing connection to land, waters, and communities. We pay our respects to them and their cultures and to elders both past and present.
Hello, this is the Buzz. Here I'm calling from Adelaide at this point in time about trachoma health and eye care. We've been at it since 1976. Got all sorts of photos around here by the people. Today's board members, yesterday's camp in Western Australia zone area, over here with the APY lands, the leaders that gave us the permission to go into the lands. A photo of my brothers there, which have all been family support for me. Over this way we have that many shots and engagements that we've had of little ones, old people, big family groups, sporting groups as well, and even the flying doctor service to help us. Generally, we put all that together, as we have done successfully since 1976, and we're still going. Trachoma is still here, and we'll still get it. Thank you.
Whatamuli, everyone. My name's Tanya Morris, and I'm a proud Barbara woman from far north Queensland. I live on Walkarookabar in Bindal Country, otherwise known as Townsville, and I'm the Acting Country Director with the Indigenous Australia program at the Fred Hollows Foundation. So welcome to the first IAP Buzz, our quarterly update on what we're doing at the Foundation. This buzz is named aptly after the health legend and superstar, Uncle Trevor Buzzacott. And this new initiative aims to help demonstrate who we are here in IAP and share the fantastic work our partners are achieving nationally. We want to continue the discussions on social justice and what we're doing in the Foundation. So our first buzz update is an introduction to our deadly team here at IAP, some of who you may or may not know already.
Hi, I'm Lauren Carr, Morawari woman and team leader with the Indigenous Australia program. I'm based here on beautiful Wiradjuri country.
My name is Zoe Hallwright. I'm a program coordinator for the Indigenous Australia program based in Melbourne. I manage partnerships with Checkup and the Institute for Urban Indigenous Health in Queensland, Lions Outback Vision in Western Australia, the Victorian Aboriginal Health Service in Melbourne, and nationally the Optometry Council of Australia and New Zealand and the First Nations Eye Health Alliance.
Hello, my name is Tanya McLeod. I work for the Fred Hollows Foundation Indigenous Australia program. My work mostly covers the Northern Territory and the Trachoma project.
Hi, I'm India Bailey. I'm based in Naarm on Wurundjeri country. I'm a program coordinator for IAP, supporting our programming in Western New South Wales, working with New South Wales Rural Doctors Network and the Outback Eye Service, and supporting our programming in Central Australia, working with Anninginny Health, Central Australian Aboriginal Congress, Nunapa Health, and the Central Australian Health Service, so Alice Springs Hospital.
Hi everyone, my name's David Ornenson, or DA. My mob is Yamaji from Western Australia. I support monitoring and evaluation across IAP and partners.
My name's Tulane Cowdery. I'm a proud Gamilaroi Bundjalung woman. I am the Senior Aboriginal and Torres Strait Islander Engagement Advisor. I sit in People and Organisational Development, formerly Social Justice.
Hi, Rachel Bowman here, Policy and Advocacy Manager for IAP. I've currently been with the Foundation for just over 6 years and with IAP for just over 1. I work from Gadigal lands of the Eora Nation here in Sydney, and I will be working hard with my team to implement the advocacy strategy this year in alignment with our Indigenous Australia country strategy and the Foundation's overall strategy. So looking forward to a big year.
Hi, I'm Madison Cassady. I'm a Ngawagi Amambara woman from North Queensland, but I currently live on Bunurong country. I'm the Senior Policy and Advocacy Advisor in the Indigenous Australia program, and I work nationally with all of our partners and stakeholders in the eye health sector.
Hi, I'm Paul Douglas. I'm a Policy and Advocacy Advisor, and I've been with the Foundation for all of 2 weeks. and I'm bidding you Biki Garumba from Turrbal, Jagera and Yuggera country.
At the start of the year, we farewelled Holly Edwards from the Social Justice and Regional Engagement team. Holly is the epitome of ally and accomplice within our space, and as Mob, we're really grateful for the work that she did for us and alongside us. We also farewelled Auntie Jackie Adams, who was the Director of Social Justice and Regional Engagement. Jackie has a 12-year lasting legacy at the Foundation, both within IAP and social justice. She always had integrity and kept Aboriginal and Torres Strait Islander rights, self-determination and health at the core of everything that she was engaged in, and we're going to miss her heaps. At the Foundation, we are still 100% committed to implementing the Uluru Statement from the Heart in full. We are also still 100% committed to social justice, not just within Australia, but globally.
The partnership between the Indigenous Australia Program and the Victorian Aboriginal Health Service, or VARS, has been going for longer than 3 years. In that time, we've supported an Aboriginal health worker to specialise in eyes. As part of their brilliant eye health team, the Aboriginal eye health worker works from VARS and in partnership with the Royal Victorian Eye and Ear Hospital to deliver amazing clinical and cultural care to their patients. In 2024, VARS, the Royal Victorian Eye and Ear Hospital, and Fred Hollows partnered to create a video showing the amazing work that they do together.
The Victorian Aboriginal Health Service is an Aboriginal community-controlled organisation. Its members are all Aboriginal and it's run and delivered by Aboriginal people to service the need of our community. The relationship with Fred Hollows Foundation has really come to fruition over the last few years with their support of Callie within his role as the Aboriginal eye health worker.
I think my role at VARS here is important because I can track the process of the patient's journey through their whole eye care. I've had training at the Eye and Ear Hospital, hands-on with certain machines. I was also able to sit in theatre and watch the surgery, how it goes along. Other training was here at VARS, the optometrists and the orthoptists that come here.
There was a big gap in our service delivery model, and we found that with the advent of Callie coming into that role, that we've been able to increase our capacity to see more people, and we wouldn't be able to do that without the support of Fred Hollows.
So that's it for our first IAP Buzz. We thought it was really important to show you the many faces behind the Fred Hollows Foundation. But what you can expect from our next updates is us sharing all of the amazing work that our partners are doing nationally so we can elevate the fantastic work that they're doing. There's also several milestones for the Indigenous Australia program this year. We'll be launching the next iteration of our country strategy. We'll be hosting a Friends of Fred event in October, and it's also the 50th year anniversary of the Trachoma project, where it all started with Fred Hollows, Gabby Hollows, and all of the staunch Aboriginal and Torres Strait Islander leaders that came before us.